Welcome to Angel Health Academy. The topic for the day or topic for the session is Contribution of Florence Nightingale in Nursing. In my last video, I have discussed about the historical development of nursing. In that, I have mentioned what is the contribution or what is the role of a Florence Nightingale in developing the modern nursing or in the historical development of nursing as a short. In this video, I would like to elaborate the content of contribution of Florence Nightingale in nursing for a separate short note. Okay. So let us start the session with a question. Why is Florence Nightingale called founder of modern nursing? As you know that Florence Nightingale is universally called founder of modern nursing. That means before the Nightingale, actually the nursing was untrained or it was done by untrained nurses. There was no such nursing organization or nurses organizations with objectives, philosophy, policies, etc. And they lacked to apply the scientific based knowledge, scientific practices, scientific principles in rendering the nursing services. That means after the arrival of Florence Nightingale in nursing, she has been contributed much in the modern nursing or development of the modern nursing. The nurses are become trained and nursing services are become organized, well organized with the set standards, with the set philosophy, policies, objectives, etc. etc. Okay, and they started to apply the evidence-based practice in nursing. Because of all this reason, the world called Florence Nightingale as founder of modern nursing. Now let us know who is Florence Nightingale. The Florence Nightingale born in 12th May 1820 in Florence, that is in Italy. So Nightingale is her family name. Okay, Florence is the place where she born. So she born 12th May. 12th May, you know that we are celebrating the International Nurses Day. So she was born in 12th May 1820 from a wealthy British family, an upper class of British family, and she was well educated, especially in mathematics, statistics, and even in philosophy. Okay, so she was born in a wealthy British family. Then later she had a strong calling, okay, from the God towards nursing profession or towards rendering nursing services, despite a heavy social resistance. So when we discussed about the history of nursing, I have mentioned somewhere in the beginning of the modern era, the image of the nursing was very poor. Okay, it was done by the drunkards, even prostitutes, etc. So the image of nursing were very poor when the Florence Nightingale entered into this profession. But she had a strong calling from the God, from the Lord of God, towards nursing or rendering nursing services to the humanity. Okay, so though she had a social resistance, she had intense oppositions from her family, from her mother, from her sister, etc. But still she came into this field or entered into this field by losing everything, the family support, the relative support, etc. Okay, so against the social resistance, because of the strong calling, she was devoted to the nursing profession. Now let us see what are her major contribution in modern nursing. Okay, so there are 7 areas I would like to talk in this session or in this video as a major contribution of Florence Nightingale in modern nursing. First one is improvement in hospital care during the Crimean War. Second, she became founder of modern nursing. So just now we have discussed why she called as a founder of modern nursing. There is founder of modern nursing. There is a second contribution. Then third one is Nightingale's environmental theory. So she put forward a theory that is called environmental theory. Still we are practicing in nursing as one of the important nursing theory, that is environmental theory of Florence Nightingale. Then fourth contribution is contribution to nursing education. Of course she had contributed much into the development of the nursing education and nursing research. So fifth one is contribution to nursing research and statistics. In the introductory part we said she was well educated in statistics, mathematics, etc. So contribution to nursing research and statistics. Then sixth contribution is in the area of hospital development, hospital administration and public health services. Hospital administration and public health services. And last one is in relation to her books. She published 2 important books, okay, most famous books, okay, that is literary contribution. So these are the 7 major contributions by Florence Nightingale to the development of the modern nursing. So before we move into the 7 contributions of the Florence Nightingale in modern nursing, we would like to know, or we should know something about the Crimean War, because Florence Nightingale contribution actually starts from Crimean War. The Crimean War is the war or a fought between Russia in one side and France and United Kingdom in other side. The period of Crimean War was between 1854 and 1856. And this war took place in Crimea. That's what it is called, the Crimean War. As the war had progressed, there was a scarcity of the needed trained nurses to render the or to serve the wounded soldiers. That led into high mortality rate among the wounded soldiers. Then Florence Nightingale is asked to visit the military hospital in Crimea and to care these wounded soldiers. So that was the beginning of the contribution from Florence Nightingale during the Crimean War. Thus, Florence Nightingale led a group of 38 nurses. So there was a team of 38 nurses. The manager or leader of that team was Florence Nightingale to care for the soldiers during the Crimean War, as per the letter she had received from the British Parliament. Okay. Thus, she went to the military hospital Crimea with the team of 38 nurses to start the nursing care services to the wounded soldiers and thus to reduce the mortality rate among the wounded soldiers. Now let us talk about the first contribution, that is improvement in hospital care during the Crimean War. So Florence Nightingale introduced the sanitation, cleanliness, sanitation, hygiene and adequate ventilation, proper ventilation of natural light in military hospital in Crimea. Thus reduced the rate of the mortality rate or death rate from 42% to just 2%. From 42% to just 2%. For that she promoted clean ward. Her goal was to make the ward clean, okay, cleanliness. Then proper hand washing or hand hygiene. Then safe water to the wounded soldiers, safe water. Then proper sewage system or sewage disposal, waste disposal, that is excreta disposal, proper sewage disposal and adequate diet, nutrition for the soldiers or balanced diet for the soldiers, vitamin C rich, etc. Okay, so she promoted clean wards, hand washing procedures, supply of safe water, and proper sewage or excreta disposal and proper diet for the soldiers. Thus she reduced the mortality rate from 42% to just 2%. Now, as you know, there is a nickname for Florence Nightingale, that is Lady with Lamp. So she used to visit the soldiers, wounded soldiers in the military hospital of Crimea at night with a lamp. Okay. Later it was given as an article by the Times, the then newspaper. Then later she became known to Lady with Lamp. Okay. Actually, it was the nickname that was given by the Time newspaper as their article heading. Okay, you can see here that article heading. Then later she become and she known at present as a Lady with a Lamp. That is about our services in the Crimean War. Okay, how she rendered the services in the Crimean War to reduce the mortality rate, and she became known to Lady with the Lamp. Now, second contribution is founder of modern nursing. As you know that we call Florence Nightingale as the founder of modern nursing, the founder, okay, because she established the nursing principles of holistic nursing principles. You know that what is holistic means? Physical, mental, social, spiritual, cultural, etc. All comes holistic. That principle is applied, okay, first time by the Florence Nightingale as a basic nursing principle to render the nursing services. And compassionate, passionate, okay, doing services with passion, with heart, with feeling, and ethical care. There are many ethical principles, the truth, honesty, etc. has to be followed while rendering the patient care services. Moreover, she also stressed about the cleanliness, proper hygiene, adequate ventilation, hand washing technique, and record keeping or documentation of the nursing care services. At the same time, she gave more importance to patient's environment as an essential tool for healing. So patient will be healed, okay, or cured from the illness or disease or wound or anything else by giving a adequate natural environment, clean and conducive environment. In addition to that, in her book Notes on Nursing, she clearly mentioned about the role, or she emphasized about the role of the nature or environment in patient care and patient healing. The nature alone cures. What nursing has to do, according to Florence Nightingale, nursing has to do means, or nursing has to do only, is to put the patient in the best condition for the nature, or put the patient in the best condition or best environment or best nature. Thus, the nature will act upon him. So, to put the patient in the best condition for nature to act upon him. With all this contribution, different contribution for the historical development and modern nursing, the Florence Nightingale came to known, or the universe accepted her as the founder of modern nursing. Then third contribution is Nightingale environmental theory. Actually, Florence Nightingale is the theorist. She developed a theory known as Nightingale's environmental theory. In that, she mentioned 5 essential components, factors or elements: pure air, pure water, efficient drainage, sewage, okay, waste disposal, cleanliness, clean and tidy, and the adequate light, especially sunlight, natural light. Okay, so the 5 essential components to improve the health or promote the health according to environmental theory by Nightingale is pure air, pure water, efficient drainage, sewage drainage or sewage disposal, cleanliness, and adequate natural light. Along with, there are some other concepts also she emphasized in her theory about the noise control, adequate observation, vigilant observation of the patient, then balanced diet, nutrition, bed and bedding, that is proper bed making, personal cleanliness, okay, hygiene, and emotional or psychological counseling and support to the patient. So these are the other concepts she emphasized in this environmental theory. This theory laid the foundation, okay, that the foundation for nursing, as now we call nursing is a science and art, based on the elements or components of Nightingale's environmental theory. We call nursing is a science and art. Then fourth contribution is contribution to nursing education by Florence Nightingale. So she founded the first scientifically based nursing school at St. Thomas Hospital, London. So Nightingale Training School for Nurses at St. Thomas Hospital, London, started in 1860 by Florence Nightingale. So she is the founder, or she started first scientifically based nursing schools. Now the hospital looks like. So you can see the picture of the St. Thomas Hospital in London. There she introduced the structured curriculum, balanced curriculum, systematically prepared curriculum or syllabus. Then clinical training or clinical practice, okay, with clinical rotation to the nurses. Then application of code of ethics in nursing, and maintaining accurate records and reports. That is documentation, okay, adequate documentation of patient care. So from that structured curriculum, clinical training, application of ethics, maintenance of the documentation, etc., they set a standard in nursing, okay, high standard in nursing, which is spread globally by her students or graduates. That is about her contribution in education. Then the next area is contribution to nursing research and statistics. She contributed much in nursing research and even statistics. So majority of the nurses may not know that she was the first nurse statistician honored by the Queen Victoria. Because during the Crimean War, the British Army as inflictions, loss of fund, okay, they were not given any fund to the Florence Nightingale. As you know, in the introductory part, we said she born at a wealthy family, okay. She collected all her wealth and asset that is belongs to her when she quit from the family or started to devote to the nursing profession. With that money, she rendered the services to the wounded people in the military hospital in Crimean. Later, she collected the fund from the British government by giving a good, appreciable statistical report as a budget. Then when she presented her budget, she used the various data, okay, statistical charts, different type of charts, and research to show the impact of hygiene on mortality. How the mortality rate is reduced from 42% to just 2%. How hygiene worked. Okay, everything she explained with the different data, different charts, and as a research, evidence-based practice. And moreover, she developed a famous coxcomb diagram that is called Nightingale rose diagram. You can see this is the Nightingale rose diagram to explain the care that is rendered based on hygiene to reduce the mortality. So she developed the famous coxcomb diagram, that is a polar area graph, that is generally called or presently called Nightingale rose diagram. With this diagram, she explained everything, how she cared, what is the expenditure for that, and she prepared the budget according to that. And later she received the money from the British government. For that preparation, they have appreciated, okay, and honored. In addition to that, she advocated evidence-based practice. EBP. Actually, now recently we use evidence-based practice. The foundation of this EBP was started with Florence Nightingale and her services in the Crimean War. So that was the foundation of evidence-based practice. Okay, long before the term existed. Now, sixth contribution is about the hospital administration and public health services by Florence Nightingale. Actually, she designed hospital layout, okay, hospital ward. So now you know that some of the hospital, they have a Nightingale ward. So it is the pavilion style. See, you see that long ward, two sides will be the patients. Okay, so the nurses can pass into the middle of that ward and they can render the services, and both sides there is a windows for the natural and cross ventilation, so the patient will get adequate ventilation, adequate lighting, etc. So this is the design which did by the Florence Nightingale, as the hospital layout is called pavilion style. So she designed the hospital layout based on the sanitation principles, adequate ventilation, adequate light, etc. Moreover, she published a book, okay, that is called Notes on Hospitals. So that gives guidelines for the hospital design, how to prepare, how to construct a ward. Okay, so that is called Notes on Hospitals. So Florence Nightingale written a book is called Notes on Hospital, that gives the guideline for all the entrepreneurs how to prepare a hospital, how to design a hospitals. That influenced the military and the civilian hospital reforms. So with that, all the military hospitals and civilian hospitals is reformed, renewed, okay, based on her book Notes on Hospital. In addition to that, she worked on public health issues, especially maintain sanitation in India. During that time, India, the mortality rate and infant mortality rate and maternal mortality rate very high. Okay, she introduced or she sent her nurses to render the services, that's to maintain the sanitation in India and to render the services to the rural people, and community hygiene, making hygienic practice in the community setting, etc. All her contribution. So thus she worked on public health issues, for example, regarding sanitation in India, rural health and community hygiene, etc. The last contribution is literary contributions. So as you know that just now we discussed, she published a book. Okay, so the important two work is, one is Notes on Nursing. Okay, what it is and what it is not to do in the hospital. In 1859 she introduced a book is called Notes on Nursing. In that she mentioned the nurse's role as put the patient into the nature and the nature will protect the patient, or to cure the patient from different diseases. Then just now we discussed the Notes on Hospitals. Then there are many reports she published, whatever she did, okay, as an evidence-based practice. That is reports on health, reports on sanitation, and reports on military reforms, military hospital renewal, okay, reforms. These all writings, her reports, Notes on Hospital, Notes on Nursing, etc. all continue to be, or still it is continuous as the guide for nursing education and nursing practice. That is about the major literary contribution of the Florence Nightingale to the modern nursing. Now you see the relevance of Nightingale today. Okay, so the basis of environmental hygiene and infection control is started from Florence Nightingale, or the contribution from Florence Nightingale. Then foundation of evidence-based practice, EBP, was the contribution of the Florence Nightingale. Then importance of documentation started with Florence Nightingale. Okay. Then role modeling, professionalism is started with Florence Nightingale. Leadership quality is started with Florence Nightingale. And application of code of ethics and professional conduct is started with Florence Nightingale. Now let us see the global influence for all her contributions. There are many global influences with Florence Nightingale work and contribution, but in this video I am just discussing a few. Okay, first one is Florence Nightingale was awarded Royal Red Cross RRC in 1883 by Queen Victoria, becoming one of its very first recipients. She was the first recipient or receiver of this honor. Okay, and honor recognizing her extraordinary services in military nursing. Okay, she done many contribution in the renewal or reform of the military nursing, and especially services rendered in Crimean War. Okay, for all this she was considered or she was awarded as Royal Red Cross in 1883 by Queen Victoria. The second important global influence is Order of Merit, OM. Florence Nightingale was the first woman to receive the Order of Merit in 1907, awarded by King Edward VII for her groundbreaking work in nursing. Her effort in development of nursing profession, public health, research and statistics, then recognizing her distinguished service to the nation. For all that, King Edward VII given an award called Order of Merit. So, thus, we celebrate the International Nurses Day on 12th May. Then all the nurses celebrate that week as a Nurses Week. So, internationally, we celebrate the International Nurses Day on 12th May. That is the birthday of Florence Nightingale. So, internationally or universally, we celebrate the International Nurses Day. Okay. That also another global influence by the Florence Nightingale in modern nursing. And on 13 August 1910, at the age of 90, the Florence Nightingale died peacefully during her sleep at home in London. Okay, so she died in August 13, 1910. So that's about the topic we discussed in this video or in this session about the major contributions of Florence Nightingale in modern nursing. So thanks for watching. Hope this video really benefits in your studies and exams. You have grabbed somehow more knowledge in relation to the contribution of Florence Nightingale in modern nursing. And if you feel it is really worth and beneficial, please like, share and subscribe my channel. And stay tuned with the Angel Health Academy for the next and important academic video. Thank you.